Hi, this is Crystal. Today I'm going to talk about mumps disease. First of all, I'm going to introduce the history of mumps. In the 410 and 640 BC, the Greek physician and Chinese medical literature document mumps. In 1934, Claude D. Johnson discovered that mumps is virus disease. Before the introduction of vaccines in the United States in 1967, mumps was a common cause of aseptic meningitis and hair loss in children. The pathogen of the mumps is mumps virus MUV, which belong to the Paramyxoviridae family. Mumps is characterized by its envelope structure, housing a single-strand native sense RNA genome. Inside the envelope, where the nucleocapsid formed that surveys and transport the viral genetic material. This picture to show structure of the mumps virus. There are few steps of pathogen of the MUV replication. Like other viruses, attachment and entry into the host cell's membrane. Utilize the host cell machinery for genetic material replication and production of new viral components. Next, assemble components within the host cell, then damage or destruction to the host cell. This process triggers the host immune response, leading to the development of virus disease and symptoms. MUV virus primarily targets the salivary gland, particularly the parotid gland located in the cheeks. In addition to the salivary gland, other areas may affect include the thyroid gland, pancreas, heart, kidneys, test in male, and ovary in female. MUV is a highly contagious disease, droplet containing the virus released by infected persons' coughs, sneeze, or talks. Inhaling these droplets can lead to infection. The MUV can also be transmitted through contact with contaminated surface and subsequent hand-to-mouth and hand-to-eye contact. MUV is a human-specific virus and is not known to be transmitted by animals. According to the research, mumps cases began to increase at around 20 Celsius and are influenced by humidity level. If the temperature increases to above 25 Celsius, the incidence of mumps declines. There are few ways to prevent mumps. Vaccination, MMR, is the most effective way to prevent mumps. Good hygiene and isolation from others can limit transmission of disease. Signs of mumps are swollen salivary gland, also known as puffy cheeks or swallow jaw, The symptoms include fever, pain, headache, muscle ache, difficulty swallowing, and general sense of discomfort. The incubation period of MUV virus is 14 to 18 days after initial exposure. Symptoms may appear 12 to 25 days after initial transmission, when the immune system responds to the virus infection by triggering an inflammatory, the body's elevated temperature. In most cases, the patient usually resolves the sickness without any complication, but if not properly managed, some potential complications may occur, such as arthritis, meningitis, encephalitis, and oophorytis in female. Some individuals may experience long-term effects, such as a hairy nose, chronic headache, and other neurological issues. Diagnosis of mumps typically involves a combination of clinical evaluation and laboratory testing, such as blood CBC, IgM antibody testing, and molecular testing named polymerase chain reaction. There is no specific antiviral medication to cure the infection due to mumps disease is a viral infection. Treatment primarily focused on relief symptoms, managing complications, and preventing the spread of the disease. According to the CDC report, currently, due to high coverage of the two-dose MMR vaccine in the United States, the reported case number has decreased from the 1990 to 2022. According to the Medscape website, in 2019 report, the mumps disease is present worldwide. The mumps vaccine in use only in 57 of countries, many those countries with more developed economies. Thank you for watching.